Of course, for many North Dakotans on Saturday and Sunday probably had a chance to connect with family or get out into the country and see North Dakota. I know I had a great Saturday, Sunday in the Badlands, so to all the friends and neighbors in Slope County, great to see everybody at spring branding. And as Ronald Reagan famously said one time, there's nothing better for the inside of a man than the outside of a horse. And so great to be with everybody, and great to see North Dakota hard at work. Yesterday, Memorial Day, the day that we take a pause as a country and reflect on the freedoms that make our country great, and on the tremendous individual sacrifices that those brave men and women have given, made that ultimate sacrifice to help defend the freedoms in our way of life. I want to thank the North Dakota National Guard, North Dakota Veterans Cemetery, and all of those individuals that were there participating in the event yesterday. It was fantastic. We had a flyover by North Dakota Air National Guard helicopters, the Blackhawks, and just a great ceremony all around. If you missed it because of something going on, you can watch the whole ceremony at the North Dakota National Guard Facebook page. Go check it out. But again, thanks to everybody for doing such a great job yesterday in the new world we're living in, to honor those individuals who fought for the freedoms that we still fight for today. The fight for freedom never ends, and we're reminded of that yesterday. One of the things that some things have changed, but one thing has remained constant throughout this, and that's that our faith in the people of North Dakota to exercise personal responsibility and look out for the well-being of their fellow citizens and neighbors. At the beginning of this month, back on May 1st, we were among the states that closed down the least, and we were among the nations that opened up the first. And it's exciting to see and observe how people are exercising personal responsibility, and at the same time looking out for the well-being of their fellow citizens and neighbors, particularly those that may be vulnerable to COVID-19. As we continue to manage the risk of COVID-19, as we work to return towards normalcy, again, we remind ourselves that this response that we had, this pause, if you will, the stepping back, was to give us time to build up our resources and capacity for testing and contact tracing, make sure we had adequate hospital capacity. We have built up testing and contact tracing. We do have adequate hospital capacity. At this point, we're still only using about 2% of hospital capacity, and so again, we continue to move forward with confidence, both in our healthcare providers and in our ability to track and contain this disease, to give everybody more confidence in our state that we can continue to keep adding more activity back, more transmissible moments back into our economy. So with that, I want to go through some numbers today. Today, the Department of Health confirmed 43 additional cases out of 976 tests. I'm only going to spend a minute on this because this represents a relatively lower day, because these are the tests for the 24-hour period for the holiday Monday. What I would like to jump to is just take a look at the tests for the whole weekend. So this would represent tests from Friday, Saturday, Sunday, and Monday. And we had a strong weekend of testing. Nearly, it's about over 1,900 on average per day testing, close to 2,000. And of the 186 positive cases this weekend, out of nearly 8,000 tests, 2.4% positive rate over those four days. And so again, great weekend of keeping the testing going for over the weekend, and that's a very positive thing, because the virus wasn't going to take the weekend off, and it's great that all of the people in our healthcare system and the labs also kept on working over the weekend to help us stay on top of this. When we take a look at serial testing, this again is this concept we've introduced a couple weeks ago, which is that we will be testing some people for a second time or possibly a third time. This can happen if you are someone who's in a long-term care facility where there's positives have been detected, or if you work in healthcare. It's very, very possible that working in healthcare could lead to getting tested multiple times. And so again, for yesterday, that lower day, Monday, this is just the numbers for yesterday. You see the 976 tests, but of those, 437 were repeats. When we take a look at the net case breakdown, currently we've got 40 hospitalized. That's one less than we had the day before. And again, in terms of recovered cases, we've now crossed the 1,700 level in terms of that. And then the recovery number, there's 150 recoveries reported today. And that is, again, in part because over the long weekend, the team had an opportunity to update case records and confirm that individuals who had recovered in the past needed to be marked as recovered and then therefore added to the dashboard. So there's a little bit of catch up on the recovereds, but that would be why our number of active cases actually dropped because we had more recovered than new reported yesterday. In terms of the next topic, I want to talk a little bit about a challenge that we had last week and how we overcame it at the lab. As we've often been saying throughout this since the beginning for months, testing is key, and if we can identify the positive cases, then we can and do effective tracing. We can isolate and reduce and slow the spread of this, and that's the way with good contact tracing and good testing, good contact tracing, and good isolation. That's the way that we can be in a very targeted way. We can make sure that we're controlling the spread, but still have our economy open. And so these things go hand in hand. The better we are at testing and tracing and isolating, the more rapidly we can take what might be an ember and put it out quickly before it turns into a real fire. And it's with more confidence we can open up our entire economy. And North Dakota's Department of Health State Lab has done a fantastic job increasing their capacity. As you see, we've been close to 2,000 a day even over the weekend. This week we've got 2 new Panther machines coming online. Each of those will be capable of running 1,000 tests a day. So our goal here is to get to being able to do at the state lab 4,000 tests a day. We've got other labs that are also contributing from the private sector, but the state lab if the Panther machines come online on schedule this week, we'll be at that 4,000 goal. All in all, since the beginning of this, the state lab has added 15 pieces of lab equipment. They've gone to operating 24 hours a day, 7 days a week, and there are over 100 new team members that are contributing to this effort. And of course, this has been an enormous team effort to build this capability, and we're building this capability not just to deal with the pandemic right now, but also to support faster economic recovery, because we know the private sector, we know that schools, we know that stadiums, we know there's going to be increased demand for testing in the future, and building up this testing capacity is one thing that's essential to us returning to full economic activity. Anyone that's ever worked in or near a lab, or anybody who's worked in any kind of complex, highly automated 21st century manufacturing business understands that in complex processes that equipment issues are part of the process. That's one of the things that people have to learn to deal with. One of the most important things is to identify issues early and correct them as quickly as possible. Last week there was a testing machine malfunction. And it impacted tests that were processed Tuesday through Thursday. This was identified by the staff because of the good practices that they have in terms of having control tests that go through. And when they found some errors in the negative control, came back positive. It came back, so it was something they knew was supposed to come back as a negative. It came back as a positive. That was as often called a false positive. They were able to go back and really diagnose and troubleshoot this problem. This is not an easy or simple to identify, but the state lab, the team put the pieces together quickly, and they made the correct decision to err on the side of caution and retest those samples. And so out of this abundance of caution, all the positive tests from 2 machines, Tuesday through Thursday, were considered inconclusive. 82 individuals were invited to retest. The team worked over the weekend. They notified 27 different medical providers, and those medical providers contacted the individuals that were affected, arranged for retesting, delivered test kits, picked up samples, and we're grateful to our local healthcare organizations and their partnership for getting these 82 individuals retested quickly. To date, we've got 60 5 of those 81 tests, and I said 82 because one individual has opted to not be retested, but is instead choosing to be just self-isolating at home, and so that will be marked as inconclusive for reporting purposes. But of the 65 retests, only 1 remained positive, 64 were negative, and so those have been updated and taken out of the positive count. So we were overstating our positives by some last week. But again, remember, we've done over 80,000 tests in the state. 1% of those would be 800. This is 82. So this is 1/10 of 1% of tests that we've had a equipment malfunction error discovered quickly. I do want to say, again, apologies to those individuals, the 82 individuals who got a positive test, who when we get done with the last 15 of these may find out that they were all negative. So again, I know that getting a call and saying you're positive for this can be challenging and traumatic. So again, accuracy is of the utmost importance to us at the state of North Dakota. Trust is the utmost important in terms of the work we're doing. And so again, our apologies to you. Those individuals. Equipment malfunction did not impact any processing over the weekend. The issue had been corrected by the time we got into the weekend. And again, I want to thank all of those people that have worked on the retesting. I want to thank those people who quickly identified that we may be getting some false positives. And I want to again thank all the local providers that helped us get everybody back and retested. Next up, I'd like to invite to the podium our lab director, Dr. Christy Mason. She's going to talk a little bit more about testing and why we've got strong confidence in our lab results. So, Christy, thanks for being here.
Hi, good afternoon, everyone. There are a lot of factors that help us determine the accuracy of PCR tests, and in ideal conditions, they are considered to be the gold standard test. Accuracy is impacted not only by the instrument and reagents used to perform the test, but also by the timing, the quality of specimen, and the biology of the individual. Because the PCR tests detect RNA that is specific for SARS-CoV-2, the specificity of the nucleic acid test for COVID-19 is very high. What we do know is that the manufacturer of the equipment and supplies have been leaders in the field for a long time. They are credible and reliable. We also have a lab full of critical thinkers who excel in what they do. The highest standards in the laboratory science world are being met every day. But now let's talk a little bit about asymptomatic cases and their impact on testing. Typically, the test result is just one piece of the puzzle that the physician will use to diagnose a patient. But because there is a high symptomatic rate for COVID-19, and because symptoms are so varied among each individual, it's more complicated because you can't just take that positive test and confirm it with their clinical picture to have a better confidence in that diagnosis. Also, the asymptomatic rate in North Dakota is about 30%. And according to the CDC, this aligns with the national asymptomatic rate, which has an average of about 35%. This is why it continues to be very important to follow the recommendations of the Department of Health and stay home when you're sick and self-isolate when you've tested positive, or quarantine if you've come in contact with an individual who has tested positive for COVID-19. It's important to do this whether you're showing symptoms or not. Masking is also important to protect those around you. You may be mildly ill or asymptomatic, and wearing a mask will reduce the risk and the likelihood that you may inadvertently pass the virus on to someone else. And that's all I have for you. Thank you.
Thank you, Dr. Mason, and Christy will be available for questions after we're done. Next up is a behavioral health update. Prior to COVID-19, and of course today, the nation is addressing a crisis of opioid addiction and overdose. Concerns continue to mount regarding the impact and the loss of life caused by opioids. You know that you can save a life if someone is at risk, if you can identify the signs of overdose, and if you've also got Narcan available. Anyone taking an opioid can be at risk of overdose. Individuals at highest risk includes those taking more than one opioid medication, people with a recent period of sobriety, or if they were living clean and sober, or individuals discharged from treatment or incarceration, because then a smaller dose can cause an overdose. Narcan is a medication that can be administered when someone experiences an overdose to save their life. The behavioral health team has naloxone available for individuals at risk of overdose, for their family members, for friends, for businesses and nonprofits. Free two-dose Narcan kits are available through the Behavioral Health Department. Please visit behavioralhealth.nd.gov/opioids or call the behavioral health team member at 701-328-8920 and request a free kit. This medication is available because of a federal grant addressing opioid overdose and prevention. 250 kits have been disseminated since April 2020. North Dakota has laws that protect individuals that seek help for someone experiencing an overdose, and also for those who administer naloxone to reduce an overdose. Those are called the Good Samaritan laws. So again, if you're with someone and they're overdosing, you're protected, they're protected. Please call 911, get help, and you'll be protected by those Good Samaritan laws. And of course, on naloxone, if you're not familiar with it, think of it almost like a nasal spray. It's just that simple. When you get the kits, you watch a short little video, and anybody can confidently deliver this and save a life. We know that most first responders and most public safety officials across the state, police and highway patrol, are carrying a Narcan. We thank them for them being on the front line of potentially saving lives. We know that addiction is a disease. It's not a moral failing, and we need to treat it like a disease, just like if it was a heart attack or something else. There's an opportunity to save a life if we could administer first aid through Narcan. And lastly, if you're someone out there who's listening, or you know someone who's been struggling with an addiction through this entire time, know that help is available, and there are many forms of effective treatment. There are multiple roads to recovery. You're not alone. Recovery is possible. The opioid overdose resources are available at behavioralhealth.nd.gov/opioids to help you identify signs of an overdose, steps to save a life during an overdose, identify those at risk of an overdose, and to learn more about the Good Samaritan and naloxone administration laws in North Dakota. And again, something that we were pleased to announce last year, Recovery Reinvented, another great service being provided by our great behavioral health team in North Dakota, is Recovery Talk. At any point in time, if you want to have a confidential visit with someone who's a trained peer support specialist from the state of North Dakota, who's got lived experience in addiction, someone who understands the recovery journey, call 1-844-44-TALK-2, 1-844-44-TALK-2, and you'll talk to somebody who's been in your shoes and walked your path, and that can be very helpful, proven to be super effective on helping people get to the road to recovery. So if you've never done it, again, completely anonymous, pick up the phone and call Recovery Talk and start your own path towards recovery. Next topic has to do with what are called the SAFER grants. This is staffing for adequate fire or emergency response. These are federal grants, provides funding directly to fire departments and volunteer firefighter interest organizations to assist in increasing the number of firefighters to help communities and to meet industry minimum standards and attain the 24-hour staffing to provide adequate protection from fire and fire-related hazards and to fulfill traditional missions of fire departments. SAFER grants support projects in two areas. One is the hiring of firefighters, to hire new additional firefighters to improve staffing levels, or changing the status of part-time or paid on-call to full-time. The second is grants that allow for the recruitment and retention of volunteer firefighters to assist fire departments with the recruitment and retention who are involved in that. There's $350 million of funding that's come available. We were reminded of that again by FEMA on our video conference with the Vice President Pence today and the Coronavirus Task Force, and the SAFER Grant Program Notice of Funding opportunity has been out for a while. There's no cost share to the applicant, and positions are fully funded to grant recipients. And again, when you're building out your capability, this can include base salary, standard benefits, et cetera. But the deadline for this is coming right up tomorrow. Deadline, May 27, 2020 at 4 p.m. You can find out more at gofema.gov. So if you're a volunteer or full-time firefighter organization in the state of North Dakota or a city official, still time tonight to get online, work on tomorrow, get your application in. I would want to say in the prior round, there was 2 successful grantees. Belcourt received $498,000, and the Standing Rock Sioux Tribe $265,000. So again, we've got a track record of being able to win those significant grants for local fire departments. Again, SAFER grants deadline tomorrow. Under the good news section, we're looking back in history today. Many exceptional North Dakotans have made a difference in the world, leaving a legacy that shines a bright light on our state and showing people what truly is legendary. And one of the great honors included in the role of being governor of North Dakota is the opportunity to recognize those legendary North Dakotans with a Theodore Roosevelt Rough Rider Award, like we did with Clint Hill this last year. But it's the 100th anniversary today of Peggy Lee's birthday. And of course, Peggy Lee, who you know, born in Jamestown, lived in Wimbledon, Nortonville, and Fargo. 45 years ago, Governor Art Link and had her become the 5th inductee to the Theodore Roosevelt Rough Rider Hall of Fame. And of course, Peggy Lee, nominated for 13 Grammys, 1 Academy Award, and in 1975, she also received an honorary doctorate from North Dakota State University. And as a young student, I had the honor of meeting Peggy Lee and giving her a dozen roses as part of her honorary doctorate. So a fun personal memory, but fun 100th anniversary of the birth of Peggy Lee. She passed away in 2002. Gratitude section. Simple quote today comes from a 74-year-old Australian writer, Rhonda Byrne. She says, "Gratitude will shift you to a higher frequency and you will attract much better things." Personally know this certainly happens when you have an opportunity to pause and you have an opportunity to observe with detail. You can increase your presence. It gives you a chance to just even taking a breath can give you a moment to understand all the great things that may be going on in your life, whether it's your personal health, whether it's your relationships, whether it's your connection with nature, or whether it's the fact that we as Americans are living in the greatest country on the planet. So much to be grateful for us to be, but gratitude can help you shift to that higher frequency. So again, take a minute and take a moment and think about that and help it reset your frequency to a higher level. Next up is just an announcement about tomorrow before we go to Q&A. Tomorrow, for the first time in nearly a decade, NASA astronauts will be launched from U.S. soil in the SpaceX Demo 2 mission. This launch is an important step in the future of the U.S. space program. We know this will be an important moment in history. Our thoughts and hopes will be with the NASA astronauts, Bob Behnken and Doug Hurley, as they lead the Demo 2 mission and the final test flight of the Crew Dragon capsule. Currently, that launch is planned tomorrow for 3:30 p.m. Central Time. We know that the weather is going to affect the launch, and as of yesterday, the Air Force's 45th Space Wing was projecting only about a 40% probability of launch. But if we do find that the launch is going to happen, then we'll be making a final decision about tomorrow's press conference around noon. We'll post more information. For right now, plan on being back here tomorrow at 3:30, but stay tuned till noon, because if the launch is going to happen at the same time at 3:30 on schedule, then we would likely push our press conference back later in the day tomorrow. And that concludes our remarks for today, and we'll move towards Q&A. We'll go online first.
Robin Travers, 660 KYZ in Williston. With the numbers now coming down in Cass County and overall, are we any closer to beginning phase 2 in North Dakota?
Well, we certainly are going to take a look at that throughout this week, and we've made some big moves each week in terms of loosening some more things up. I mean, a big one was going up to the groups of up to 250. Which we've already done. We will certainly take a look at that. And again, relative to, want to get people to focus on what we're calling the threat levels. There's this, what we're calling the fire danger. We've got the five colors and the dial and the five levels, and we're at the middle level at level 3 right now. When we go to level 2, we've set the stage that we could do it statewide or we could do it by county, and we'll be taking a look at the numbers by each individual county as well as by the state as we evaluate that, and I'm certain we'll have more to update by Friday on that topic. And I should remember we have Dr. Mason here also for questions. Going to go to Jacob.
Just wondering if there's an update on the establishment of the private-public partnerships to get up to 6,000 tests by June.
I'm not sure if Christy heard that question. She may or may not want to comment on that, but we did do I do know that the question was about a test or private-public test partnership, but we did develop a relationship with a national firm. They met our standard. We got results back in 33 hours on the test batch that we sent to them, and that certainly seems promising. That relationship could expand as another sort of leg on the testing stool. Also this morning on the call with the video conference with the Vice President and Dr. Birx and others, they indicated that there was a substantial capacity that have opened up at some of the national labs that were contracted earlier, Quest and LabCorp, and specifically they were indicating that they thought that there was 50 to 100,000 tests a day kind of capacity that could be available there for states. Some states are taking advantage of that, and so we'll keep looking at these. But the initial test that we had with the test, and someone gave me the name of the company and the location. I think it's in North Carolina. But again, the key for us is quality and turnaround time that we're looking for if we're going to be in a relationship with a national source. Okay, going back online.
Hannah Shirley with the Grand Forks Herald. How many nursing homes and long-term care facilities have had to retest residents after the apparent false positives? And what is being done to address those false positives, particularly for those populations?
I don't know the answer. Maybe the second part of the question, Christy wants to come back. She may have to repeat that again on what's being done to address false positives. But the breakdown of the 82 positives that we had across 15 counties and 27 providers, I don't have in front of me how many of those were actually either nursing home residents or staff. But perhaps if Christy doesn't, maybe somebody else can find them. But maybe Christy wants to answer the second part of the question. Dr. Mason.
Yes. I believe the question was about what we're doing to prevent false positives in the future.
Yep, particularly for populations in long-term care facilities.
So when samples enter the laboratory, we actually do not treat them any differently. We treat everything as if they're high priority. We're actually trained early on to treat every patient or every sample that comes in as if it was a sample from our parents or our grandparents. So we treat every specimen the same. That helps ensure reproducibility and reliability. So we don't do anything different in particular for long-term care facilities. But we have internal and external quality controls that we perform every day on every run to ensure that there is a minimal risk of having these false positives occur. It was actually the vigilance and the expertise of our laboratory personnel that was able to identify this. This was something that would have been really hard to catch, and it's an incredibly smart team that thought something was a little bit off. We did some checks, and then we lost confidence in the runs that actually worked well. And those are the ones that we went back and investigated further, and those are the 82 that turned to be inconclusive.
I sort of a related question to that. These 82 tests are sort of a visible example of potential false positives. How often does this happen just in the normal course of your work?
So normally, any time that something doesn't work right or QC fails, anything like that, we reject the run and we retest the specimen. Other inconclusive results will happen if I run a specimen and a run fails and there's no longer enough specimen to repeat that test. I don't know if it's positive or negative anymore. I attempted to run it, and so we will report out an inconclusive result.
Get that person retested?
Yeah, then our recommendation, anytime we release an inconclusive result, our recommendation is to retest that individual.
Running Dean, Williston Herald. What is the rate of false positives expected for this type of test if everything is done right, and how many false positives have we had?
It's really hard to identify a false positive. It's inherently built into testing. So there's no way to go, you know what, you actually didn't have the disease, and that gets even harder to identify when you have a disease that's very asymptomatic, and because then a doctor can't go, you know what, I really don't believe that result. This looks like you have coronavirus. Everything tells me you have coronavirus, but the lab doesn't agree. They're saying it's positive or negative, whichever way. And so it's done on the initial validation studies, but we strive for 100% sensitivity and specificity in all of the assays. Sure.
But just a little off topic, what's your current turnaround time for results?
Anywhere between 24 and 48 hours once we receive the specimen. Do remember that it takes time for the specimens to travel around the state and get to our laboratory, but once we receive it, 24 to 48 hours.
How's your staffing level? How many people are working at one time? And are you still working around the clock?
Yeah, we're working around the clock. The day shift, which is our highest volume, has the largest number of employees. It varies by day depending on how many people are available to help us. But every day during the week, we typically have our original crew of 18 and the civil support team and other National Guard and Air Force members that are helping us.
Thank you, Christy. And this might have been Jean's question coming in now. The answer about how many of the 82 were at long-term care facilities. 35 of the 82 individuals were at 15 different long-term care facilities, and that 35 was broken down into 7 residents and 28 healthcare workers. And those 35 are all, as my understanding, those 35 are all negative. Now, they were part of that, the 82 false positives. Jeremy?
This is sort of tangentially related to COVID, I guess, but President Trump said again today that mail-in voting can lead to corruption, and he's said that he would consider taking away federal funding from states that do mail-in voting. I'm just wondering what your thoughts are on that at this point.
Well, I think in any voting process, there's a need for people to be very thorough about making sure that people who are of the right age, at the right geography, and are eligible to vote, and that they only vote once. I mean, that's been around since, democracies have begun. And I think that in North Dakota, we've got very good processes in place. As we know, we've had 33 counties prior to this had done primarily mail-in voting with the option for one physical location. This year, the counties were given the ability to choose to not even have the one and go to, during the primary, just a strict mail-in situation. The counties all have voted to do that, and I'm between our Secretary of State's office and local election officials in the counties. I have a good degree of confidence that everybody's making sure that we're hitting the target of getting ballots to real North Dakotans with real addresses of the right age, and they're voting in the right districts where they live. We're probably fortunate in a smaller state where people fewer numbers of people, and people have a better sense of knowing who they are, to make sure that we wouldn't have sort of widespread corruption. But I also think that there's be tools that can be applied. If we saw wide aberrations coming in terms of say a precinct that in the past had a certain number of votes for the last 20 years, and then they had some wildly different number of votes, you'd probably want to say, hey, we should probably investigate that. And some some people might call that artificial intelligence, or maybe just call it, exception reporting. But I think we've got to be, when we have to make sure that we've got the tools and the technologies to make sure that we're making sure that if there's any sort of obvious abnormalities compared to past voting patterns, that we're all on top of that, because democracy depends on people having confidence in their election system, and there has been additional dollars provided by the feds. There's I think $3 million that came in as a grant that was passed by the Emergency Commission in the budget section that the Secretary of State has available for helping to conduct elections during this time period. And so we got the resources and we have the experience, and I think we should have the knowledge to make sure that we can make sure we've got safe, clean elections here in North Dakota.
Follow up very quickly. In your mind, there would be no reason to doubt the outcome of the primary elections, right?
Well, they haven't happened yet. So if we had if you had a precinct that came in at 3 times as many votes as it ever had in history, that's what I'm saying. Sometimes you don't know till after the fact if there would be a reason to that might raise doubt that would cause someone to take a look. But right now I've got good confidence that we're on a good trajectory right now. Jacob?
Going off of that, as part of the mail-in ballot, voters have to buy a stamp for it. Some have called this a poll tax, which is unconstitutional. Do you believe this is a poll tax?
There is an opportunity for someone to drop off their ballot at a box without putting a stamp on it. And to the degree that if I guess maybe with super low historic gasoline prices, and if someone had no value on their time, then maybe the stamp costs more than their own time and the gasoline to drive to the poll and wait in line to vote. But there's cost to voting in person, and there's cost to voting online. I guess an alternative would be to think about whether or not we should provide return envelopes prepaid as part of that process would be something I guess maybe the legislature could look at if people thought that was a concern. But again, I know that there are locations posted online about where the drop boxes are, where people can drop their ballots. Okay, we'll go back to online.
Jean Shemp, Hometown Radio Group in Minot and Bottineau. Currently, the CDC says an asymptomatic person who tests positive and remains asymptomatic following that test for 10 days can be classified as recovered. If they never develop symptoms, how can the state be sure that they are not still contagious without a negative test? To confirm that.
Again, if we had an epidemiologist here, maybe they could answer this. I don't know if Christy wants to try to answer this one. I'll just take the first stab at it. But I've asked the same question, Jean, about recovered in the 10-day period. And my understanding is that after a person has tested positive, and if they're asymptomatic for 10 days and you test them again, the possibility of having enough viral load to come up with a positive test is very low, and so that you could burn a lot of testing resources trying to confirm this. But the person develops the antibodies, they're not sick, they're not consuming any health care. They're not consuming any healthcare capacity, which is again the thing we're really trying to manage. And so I think that it was longer initially. I think the CDC had it at 14 days. They lowered it to 10, and obviously they've done that on a lot of data, on a lot of testing, on a lot of people to come up with that standard. So that's how I believe we got to where we are on the 10-day piece. But Christy, anything you want to add to that?
I can add to
Okay.
So with PCR tests, we actually are looking at the viral RNA, and we don't know if the virus is alive or dead. And so you'll have this shedding that can happen afterwards, even though they're not infectious. And so studies have shown that after, I believe, 9 days, they're having trouble, or they're not getting the virus to grow in culture, which means it's no longer viable, but they may still be shedding viral parts and have a positive PCR test. So a positive PCR test doesn't necessarily tell you a patient's ability to infect another person.
So the key definition there of recovered is the understanding that they're not in a position to infect somebody else, which is what we're really trying to manage, is slowing the spread of infection, which is why we've got the 10-day recovered in the quarantine rules. Dave?
Word from the task force and the Long-Term Care Association that's working on perhaps new procedures to allow families to visit their loved ones who are in long-term care facilities?
I believe last week when Chris Jones was here, we said we'd have an update this week, so we'll look forward to hearing that this week. Online?
Scott Hennon, WZFG KFYR Radio. As the next phases of reopening are considered, what role will the county-by-county numbers play in allowing restrictions to be lifted in counties with low case counts?
Well, there'll be, for Scott, one of the questions one of the factors that we'll look at on reopening is going to be county by county numbers. We're going to look at it as a state. We're going to look at adjacent counties because we know that the virus doesn't know where the county lines are, it doesn't know where state lines are. So it's a little bit about the county and those other counties surrounding it. So we'll take a look at all that. It can also we could look at population density. Obviously, and we've got some very rural, low population counties that are by nature doing more physical distancing than some of our higher density metro areas. So we'll try to take a look at all of those, and there's going to be some art, some science, some math, some statistics, and just some good judgment, some on the ground sense of how people are doing, and if we make a decision on whether we do it on an entire state to the level 2, or whether we do it a combination of counties that may go forward or not to the next level of reopening. Okay, things are slowing down. We had a little bit of a lighter show today. We got plenty of other topics coming up this week, but I want to thank everybody for being here today, and we'll look forward to giving you an update tomorrow at noon about what time, whether or not we're going ahead at 3:30, whether we're launching at 3:30 or whether the spacecraft is launching at 3:30. Okay, thank you all. See you tomorrow, one way or the other, and thank you, Dr. Mason.